Welcome, everyone. Look at all those friends coming in, signing on. Familiar faces, new faces. I love it. Welcome, everyone. We are so happy to have you joining us for our August BPNN quarterly call, where it's all about wellness, being in the community, and really exploring how mental health policies can support families. We are so excited that you took time out of your very busy day and schedule to join us today. We would love to know who is joining us today. Please feel free to share in the chat your name, your role, your state. Let us know, where are you joining us from? This is the best part as we get these kicked off. I see Isabel. It's so great to have you with us from Oklahoma and the incredible work you do with the Parent Partnership Board there. Brianna, welcome from Missouri. Love it. Love having so many people here from Las Vegas, California, Texas, Oregon, Baltimore. My BFPP, our birth and foster parent partnership, they are true troopers today. They are like coordinating, coming in from different webinars. There's been so many great activities going on. Welcome, everyone. Caitlin, it's also awesome to have you here. Another one of our Oklahoma family. And Charles from Minnesota. Kim from, it's sunny in South Carolina. Maybe that's where I need to be going for my vacation next week. Rigel, you are here from Pennsylvania. So good to have you here. Dee, oh my gosh, you must have heard us. We were talking about you, Dee, and we're like, oh, we have to have Dee in this space. So it is awesome to have the lovely Dee Bonnick here. Amanda from Rhode Island, welcome. Michael from Oregon, welcome one and all. We are so thankful to see you all, having you all here. And so I encourage you, please, throughout the webinar today, feel free to put in the chat questions, comments, thoughts, and reactions, because one of the things that being in this role, I am Kara, Georgia, and I live in New York State, and being a parent, it can be tricky. And when I came into the role of Parent Partnership Associate with the Children's Trust Fund Alliance, the biggest lesson I learned is it's very important to listen to how parents elevate different topics, because as parents, we don't always just pull it right out and here it is. It's conversations, it's those relationships and those moments. And today's webinar is really dedicated to that, because our Birth Parent National Network has said on numerous feedback loops, we need to start talking about mental health. And so today is the beginning of that. And we look forward to being able to enter into this conversation. As I get going with the webinar today, I am joined by two of our incredible co-facilitators from the Birth Parent National Network who will be helping us today. Tremel Mitchell is an incredible father leader from the state of Alabama, and he's going to be actually sharing a little bit later in our Parent Spotlight section. And then I have the privilege to also work with Jody Rogers in this role. And as we were getting ready for the webinar, one of the things we were thinking about is, so often with mental health, there can be a lot of different feels and a lot of different thoughts. And we were trying to figure out, how do we make it so that mental health feels approachable, like our physical health, our dental health, our overall well-being. It was trying to figure out, how do we create a space where we normalize asking for help and we actually celebrate it, because it's hard as a parent to say, I can't do this, or I don't know how to do this right now. And so it's trying to figure out, how do we help create that space and that opportunity for us to elevate when we're feeling a bunch of feels and we need help sorting it out or thinking it through, or we need help and opportunities to help our children or our family members or our friends who might also be struggling with mental health. So today's a great opportunity for us to celebrate and talk about, this is the beginning of how we talk about wellness and how we normalize seeking out mental health and additional supports and resources. It's also an opportunity for us to talk about what are current policies that are happening and how we can be informed and equip ourselves with these tools as a network to bring this back to our communities and our states and our organizations and say, what could we do differently? What else could we do? How else could we respond? And what might we do in a different way? I would like now to give the opportunity to Jody, who's our fantastic lead co-facilitator for the beginning portion of today. to share a little bit. And I'm wondering, Jody, what are you thinking about as we think about this topic of wellness and mental health? What's on the top of your mind?
Thank you, Kara. So I want to say, like, when I'm hearing wellness begins in the community, right? The first thing that comes to my mind is like, that couldn't be more correct. I am absolutely grateful. I will say, like, as a mother, but also as a parent support, right? That we are talking about this conversation. And so I'm just going to share what's in my heart right now, because I think that's like where I need to go. But like in my mind, I'm thinking like it's really the community's responsibility, right? When you see a parent struggling, when you see maybe one of her kids are struggling with mental health, or maybe the parent is struggling with mental health, right? Reach out, offer support. What can I do to help you? Like, I love when I hear like mandated. I am a mandated supporter, right? So like, I think it is the responsibility of our community to all reach out and just wrap around each other, because as a mother of a son who struggles with mental health, I cannot begin to tell you how many times my neighbors just call the cops, right? The cops, like just last week, they knock on the door like, hey, I'm so sorry. Like, we just have to kind of do a well check. And they do this check-in with my son. And each time I think, imagine if that person came over and said, Jody, I can see that you are a dedicated mom. I see you're a loving mom. How can I help you? Like, imagine what that would do for me, not just as like a person, but as a mother, and how supported I would feel. And so when I'm talking about this, I also want to bring in, so something about me, many of you may know, is like, I'm a really passionate about the work I do with parents, but like the core of that passion is in the work I do with fathers. And a little bit underneath that is that I wonder, so my son's dad also struggled with mental health, and he's a dad. And if I'm being honest, like, we are not in a system that's really set up to fully support fathers. So like, as I try to support my son to the best I can't help but wonder all the time, if my kid's dad could have gotten even half the support that I did, he would probably be here today to help me. And when I say here, I mean like healthy and present in the way that I am for my kids, but to help me with my son. And in my core, I know that he's the one person that could reach my son like nobody else could. And so I just think that that's a really important topic, and I really wanted to highlight that. And I think that the two really do go hand in hand. So like, really, as a community, we should all be leaning into each other. So with that said, Kara, I am going to ask if we can bring up the agenda. I'm going to move us over to the agenda. We have a packed agenda today with some great policy updates coming from Casey Family Programs and the Children's Trust Fund Alliance. Then we are going to take some time for questions. And after that, we will get to hear a few parents from the BPNN share thoughts with us as we think about taking today's content to impact policy and practice in your states and communities. We will have a brief time to collectively do brainstorming and then see some resources and tools that we can use, as well as hear important announcements as you complete today's evaluation. So we are excited to have Emily with us today. She is the Director of Policy with Casey Family Programs, here to share some public policy updates with us. Emily, welcome.
Thank you. So with Kara, it's good to be with you all again today. Again, I'm Emily Heck McGowan. I am a director on the public policy team in the DC office for Casey Family Programs. And when Kara and I were talking about today's topic, which is mental health, she asked me to provide a brief update on what's been going on in the policy world. And so I started to do that, and you'll see that I have several slides today. all of them packed with lots of text and words. And I'm not going to cover everything that's on these slides today. I just wanted to give everybody an idea of the breadth and scope of the work that's being done in this particular area. It is voluminous at the federal level. Both Congress has been working on mental health across the board in both the House and the Senate. And the federal agencies have been laser focused almost on mental health, particularly in the U.S. Department of Health and Human Services. So I'm just going to give you kind of a sprinkling of an update of the kinds of work that's going on and the things that have been coming out from Health and Human Services to help communities across the country kind of address the needs and concerns in communities across the country. So here you'll see we've got a number of items where HHS has worked in behavioral health care in the community, at the community level. HHS has done a number of things, which include proposed new standards to ensure access to healthcare, including behavioral healthcare and Medicaid and CHIP. And HHS has issued a couple of proposed rules, which the rules are how Medicaid and CHIP are implemented at the state level. And they have increased access, tried to increase access, not just access, but equitable access across the country. The rules would establish kind of historic national standards to access care, regardless of whether that care is provided in a managed care plan or through fee-for-service. It increases healthcare. New guidance from HHS in this space is increasing healthcare for people who are leaving carceral facilities. There is a demonstration opportunity which is focusing on covering high quality services for those individuals who are currently incarcerated, eligible for Medicaid, and returning home to their communities. This is a group that's been historically underserved and adversely affected by poverty and inequity. And this particular rule change with HHS is attempting to increase access and set folks up who are leaving, who are integrating back into their communities to help set folks up for success and remove at least one of those barriers to reintegration. HHS also released their first national strategy to support family caregivers. This national strategy outlined about 350 actions that the federal government's taking to support family caregivers in the coming year. And 150 of those actions can be adopted at state and local levels across the private sector to help build a system of support for family caregivers, many of whom have been under extra strain during COVID-19 and coming out of the pandemic. Another area where HHS has been focused is increasing access to quality evidence-based behavioral health services in rural communities. Again, another area where there's been significant underserving of communities that need them. So they've awarded about $29 million to 58 different grantees across the country to help improve the quality and sustainability of behavioral health care in rural communities. And this includes the provision of evidence-based, trauma-informed substance use treatment and facilities. HHS launched a national maternal health hotline, and this is to increase support information, referrals to pregnant and postpartum individuals facing mental health challenges and their loved ones. So if a partner or spouse is under strain because the pregnant or parenting or birthing parent has exhibited some postpartum stresses, the family members can also call in and get supports. This is a national 24 hours a day, 7 days a week, 365 days a year service, and it provides free and confidential support. It provides support in English and Spanish, and it has a translation service for 60 other languages. It also has a relay service for folks who are deaf or hard of hearing. HHS is also focused significantly on the health and human services workforce to better provide mental health services for folks working in human services, which can be a very stressful area of professional area of service. New cooperative agreements now exist with the Children's Bureau to expand the National Mental Health Training Initiative and web-based trainings for the child welfare workforce and mental health practitioners to increase their capacity, not only just to take care of their own mental health and well-being, but to help increase their capacity to serve children and youth who are currently in the child welfare system. There's also a huge focus on, again, a lot of what HHS is trying to do is reaching those traditionally underserved communities. So they released a resource on expanding behavioral health care for people experiencing homelessness. SAMHSA, the Substance Abuse Mental Health Services Administration, I think is what the acronym stands for. They're expanding access to use of behavioral health services for people at risk for or who are currently experiencing homelessness. They highlighting strategies for behavioral health and housing providers to conduct outreach and engage with individuals who are experiencing housing challenges. If you want to go, Kara, to the next slide, the crisis support specifically, we heard a lot about the launch of the 988 Lifeline, which was launched in 2022. And there has been a huge as the Lifeline has been functional, there's been a lot of kind of assessing and upgrading and redirecting of the work that's being done, and that the numbers of calls, texts, and chats that have been received have gone from about 892,000 during the first 6 months of operation to up to 2.1 million contacts from July to December of 2022, which was the second 6 months of operation. The 988 Lifeline has also established a specific tribal response program where they have allocated about $150 million in funding to expand the capacity of the 988 Lifeline to specifically respond to tribal nations and support tribal nations in building out their crisis response and providing technical assistance to grantees so that they can provide culturally responsive supports to tribal nations. The 988 Lifeline has also launched some specialized supports for LGBTQI youth and adults. So when someone from the LGBTQ plus community calls in, they can be referred specifically to someone who has competencies in those particular subject areas. And there's a specialized crisis support line for Spanish speakers. So there's been a lot of upgrading to the 988 Lifeline. A couple of other areas in the crisis supports. There has been, the pandemic, I think, highlighted the need for mobile crisis intervention services, and there was some funding allocated in the pandemic relief packages that really supported with extra federal matching dollars development of mobile crisis supports to go into communities and serve folks where they are in their homes with trusted providers. And HHS has worked with states to significantly expand those services. They've worked with specifically with state plans in Oregon, Arizona, and North Carolina, but also provided technical assistance to 27 additional states to increase their capacity for mobile crisis, to provide mobile crisis services. So that's a huge expansion from where we were just a couple of short years ago prior to the pandemic. There has also been, I think, can you go to the next slide, Kara? So workforce, we have heard a lot of information, a lot of reporting around kind of the taxing on the mental health workforce. So there's been a lot of focus on how do we prevent burnout, what can Congress do, what can HHS do around assisting, and not just assisting those who are already in the mental health and behavioral health workforce, but also how do we kind of increase that pipeline for developing more folks to go into these professions. So there's been a lot of focus on increasing the capacity of pediatric mental health care providers and programs. You'll see here there's been 20 million awarded for the Pediatric Mental Health Care Access Program, which helps states to develop regional pediatric mental health care and telehealth access programs to support the improvement of existing statewide programs or development of new statewide programs. There's been a funding and a focus on providing training and technical assistance to support the integration of behavioral health into primary care. So if you go to a doctor, either your pediatrician or your primary care provider, that care provider you don't have to go to a separate space necessarily to receive mental health or behavioral health supports. HHS is trying to work with providers to integrate behavioral health into primary care, so you can receive services at one point of entry, which removes some barriers to receiving services. There's been some work in the area of pipeline. So HHS has awarded about $60 million to train primary care residents in mental health. So this is being integrated into educational programming for doctors, so that they can be better trained in spotting where there are mental health concerns and where interventions could be useful. There's also new funding opportunities to expand screening and treatment for maternal mental health and substance use disorders. So funding that will support states and tribes and tribal organizations to expand healthcare providers' capacity to screen and assess, treat, and refer pregnant and postpartum women for maternal depression and related behavioral disorders like anxiety and substance use. Screening and treatment program uses telehealth and other strategies to provide real-time consultation. This can also be seen in the area of prevention from a child welfare standpoint, really giving people access to frontline providers in the areas of mental health. And there's been a great deal of work in the area of diversifying the behavioral health workforce. There have been, so SAMHSA is supporting and expanding their minority fellowship program, which awards grants to support graduate level behavioral health clinicians to serve individuals in high need and underserved communities. And this includes urban areas as well as rural areas where provider networks are sometimes more scarce and sometimes do not reflect the populations of the communities that are being served. So SAMHSA is really working to diversify the profession in those spaces. The last thing that I'll highlight is that HHS has also looked at non-clinical ways to bolster the behavioral health workforce with non-clinical providers. So in certain cases, that's really building up the peer specialist support network, parent partners, et cetera. And HHS released in April, a couple months ago, a model for peer specialist certification, a national model. And that was that national model standards were designed with lived experience experts at the table to improve the consistency and quality of peer specialist providers across the nation. And I think those standards also include things like equitable pay and benefits for peer specialists in those spaces to really, and the broader the networks of peer specialists, the more support non-clinical providers can help the clinicians to really provide access to strong mental health and behavioral health programs and services and networks. The next slide is going to cover kind of only a handful of where HHS has really focused on mental health and behavioral health programs for young people. And as parents, we all want to make sure that we can access the necessary supports for our children when they're needed. And I think we can all agree that the mental health and behavioral health needs have risen across the board for youth. And for youth who are kind of experiencing a lot of different intersectional vulnerabilities, I think it's even heightened. So HHS has awarded nearly $185 million to support youth mental health and to help the healthcare workforce meet families' mental health needs. And just a few highlights of where that money has been going. There's about $74 million that's gone to help develop and support school-based mental health programs and services. I know my home school for my kids has a clinic, a medical clinic housed in the school, and mental health and behavioral health services and supports are part of that service provision. About $60 million has gone to prepare and train school personnel, emergency first responders, law enforcement, and others to recognize the signs and symptoms of mental health challenges for youth and help enable early intervention and appropriate intervention. I want to highlight that. All this is around appropriate early intervention. There's $15 million has gone for school-based trauma-informed support services and mental health care for children and youth to increase student access to evidence-based and culturally relevant trauma-informed services and mental health care. About $20 million has gone to improve treatment and services for children and families that have experienced traumatic events. There has been about $20 million to promote resilience and equity and prevent violence in communities that have recently faced civil unrest and community violence and collective trauma. So there are real targeted efforts at HHS to serve particularly high needs populations. There has also been a great deal of work around implementation of Family First, increased prevention services for children at risk of entering foster care. So the Children's Bureau has now approved 42, might be 43 now, my number may be off, Title IV prevention plans. And there are only a handful of states, I think there are 5 states now who have not submitted their plans for approval. I believe there are 43 total that have been approved, several that are awaiting approval, and only 5 that have yet to be submitted. The HHS has held several virtual convenings and trainings on a host of different areas around children's mental health. They held a virtual training for parents and caregivers on mental health generally for young people, and a convening for specifically to support Latino youth mental health. There's been an effort to expand access to mental health services in early childhood settings. And they've awarded several $1 million to promote mental health of Black youth in particular, understanding that there are particular considerations for different constituencies and communities. There's also been, I don't know, you've probably seen it. I think we've circulated a bunch of resources, but HHS has, or ACF has launched a behavioral health focused webpage where many of these resources are condensed and can be easily accessed on mental health resources for families and youth, for grantees, for tribes, state and local human services programs. So they've tried to create this hub where information can be easily accessed. They've also released a handful, well, not a handful, a bunch of really innovative landmark reports. I think we all remember, I believe it was in 2021, where the Surgeon General issued a report really highlighting the crisis of youth mental health in the United States. And since then, they've released landmark reports on different constituencies, one on LGBTQ plus youth, that also spawn kind of a whole bunch of resources for LGBTQ youth. They've issued informational memoranda on strengthening access to services for children, how to leverage Medicaid, CHIP, and other federal programs. So there's a lot of really helpful information coming out from HHS, not just on the programs that they're now implementing or dollars that they're awarding. They're really trying to and have put out a number of informational bulletins, kind of helping folks understand how to navigate the system and kind of explain what's out there, and how providers and individuals can go and leverage the programs and services that are being offered. There's a ton of other stuff, and I'm going to stop. I'm just going to end with Congress is also doing some things. And I think the most relevant thing that's happened recently is that the House has the Energy and Commerce Committee, the full committee has moved to the House floor the reauthorization of the Support Act, which is all about providing substance use and behavioral health resources to treat needs in communities across the country. That's been teed up for reauthorization in the House. The Senate has introduced its own version of the bill. The House has also passed a number of other pieces of legislation that has teed up for passage, my apologies, along with the Support Act, which will really bolster the ability of Medicaid, CHIP, Medicare, and other providers to provide access to a real diverse and broad array of mental health supports and community-based supports at the state and local level. So I'm going to stop there. I'm going to kick it over to Jim, and I hope I left enough time. I'm so sorry. There's just a lot.
Thanks, Emily. No, that was great. We're excited that there is so much interest in the administration and Congress, bipartisan support for mental health, and just want to express my appreciation for everyone who's on as we talk about this topic and how mental health begins at the community level. It's great that we have these federal supports, but it does ultimately. We know that not every community has the same access, and there are issues of equity and so forth to address. As Emily mentioned, just a few of the federal legislation I want to mention, and I'm going to share a couple of resources and make sure we answer questions. The Support Act, initially passed in 2018, signed into law with bipartisan support, really extended, helped address the substance use disorder and overdoses. There's some improvements that we'd like to see, and that lawmakers on both sides of the aisle are working to enact there. We're hearing there may be some interest in addressing some of the improvements that many of us have been looking at with plans of safe care, and the fact that when someone's pregnant and accessing medically assisted treatment, that should not inherently trigger a CPS investigation, that someone is being well and addressing their addiction and working to be healthy, that should be addressed as a health issue. And so we're looking for opportunities. There seems to be some strong bipartisan support, both House and Senate, for the Support Act. Also wanted to mention the Rise from Trauma Act. That stands for Resilience, Investment, Support, and Expansion. And this idea of how do we thrive despite trauma and through trauma. And so that bill would provide funding for a lot of community-based work, as well as extending some of the trauma-responsive schools and some of the funding that the Center for Disease Control, CDC, has received for ACEs and that type of effort. So we're excited to see Senator Durbin, Senator Capito, bipartisan support again in the House and Senate for a Rise from Trauma Act. Also, the appropriations process is really underway right now. All these investments that Emily went over that we're very excited through the bipartisan action last year to invest. We want to see those appropriations sustained. And right now there is a difference in approach between House leadership and their budget bill, which largely restores things to the fiscal year 2022, whereas the debt ceiling agreement that was passed in the spring, the Senate bipartisan appropriations bills have largely kept current funding levels for domestic spending. And so there'll be some negotiations across the board as we go through September. So I want to keep an eye on all of that. We can go on to the next slide. I'm really excited to share. So I was in DC a few weeks ago, and one of the things that lawmakers were saying is, every advocacy group like ours come and we always want more. And we do, because families need more. We got a lot of work to do, but an initiative that they were really excited about, it's called the Green Lights Grants Initiative. Matthew McConaughey, may have heard of him, and his foundation. So the last year in 2022, there was passage of the Bipartisan Community Safety Act. And why don't we just go ahead and let Matthew share this, and we'll hear from him, and then I'll try to chime in. We can go to the next slide with the video.
On June 25th, 2022, the Bipartisan Safer Communities Act was signed into law following the Robb Elementary School tragedy in my hometown of Uvalde, Texas. Now, part of this bill sets aside billions of dollars to make American schools safer. That's money to pay for mental health resources and security for safer schools to ensure that our kids can learn in peace and without fear. The problem is, not enough school districts that need these grants know how to apply for them. And for those that do, it is a complex and expensive process. But now, we have a solution. The Green Lights Grant Initiative. It will, 1, get the word out that this money is there for schools that want and need it. 2, it will help school administrators apply for these grants by letting them know when the deadlines are, what the grants pay for, and how to apply. We're even going to provide professional grant writing services, all at no cost to schools. That's right. It's free. When Camilla and I went to Uvalde, the parents and the family members of the children that were killed asked for one thing: make their lives matter. But let's make sure that the first bill passed in 28 years to help protect all of our children in schools matters. Learn how your district can get help applying for school safety grants at greenlightsgrantinitiative.org.
So I see Marty's question. Yeah, that's Matthew McConaughey, star of We Are Marshall, which was filmed near where I live in West Virginia, and like to refer to him as my co-star in that film, just for fun. But real quick, the Bipartisan Safer Communities Act has nearly, as we heard in the video, $1 billion. So just real quick, the Department of Education, a lot of these were referenced by Emily, and we're going to get you these slides so you can see this. This is from the Department of Education. Go on to the next slide. We've got SAMHSA, including Project Aware, which our good friend Deborah Chosewood is running, helping lead that work in the state of Georgia. She's one of our board members for the Alliance. The 988 Suicide Crisis Lifeline, doing a lot of great work. In human services, again, a lot of the great work we heard about. This just voluminous amount of information that's out there. So we're excited to look at what Green Lights Grant Initiative can do as a partner for these investments at the community level. Go ahead and go to the next slide here. The other thing I wanted to mention, and I'm going to share in the chat a few links, but as we've come through the pandemic, a lot of the expansions that we have seen have been results of broader supports for families. But one of those key aspects was, for the duration of the public health crisis, Medicaid was not redetermined for families. Children's health insurance, the CHIP program, was not redetermined, but that is now going away. And so just this year, we have seen millions of people across this country lose access to Medicaid and CHIP, and over 73% of those who have lost it are still eligible, but just lost their coverage due to a procedural reason, the paperwork. So go to the next slide. I just want to share, and I'll pop in the link. I know this is real small, but this is a list of all the states, the red on this screen. So this is the percentage of people that have been kicked off of Medicaid. And the red is those that are just lost Medicaid due to red tape, just not getting the paperwork in, not being classified. So CMS, the group that national group that does Medicaid, if I go to the next slide, has had some recommendations and strategies. So we've got strategies for those of us who are Medicaid agencies or trust funds that are working alongside our Medicaid agencies. Again, these slides are going to come out to everybody so you can see this. There's webinars on this whole topic, but we need to be advocating that our state does every applicable strategy and waiver to support continued coverage. We need to make sure that the child's eligibility is considered separately from family eligibility because of poverty deadlines and so forth, guidelines. We need to make sure there's express line eligibility if you're eligible for one thing, and that means you're probably going to be eligible for something else. Let's make sure that happens. We have a lot of paperwork on families and data already in our systems. If it indicates that someone should be eligible for Medicaid, let's make sure they get their Medicaid and keep their Medicaid. Next slide real quick. There's advocacy strategies for us as community partners. So how can we use social media and help families understand? There's social media graphics, there's different posters we can put up at our family support centers and so forth. It's really important for families to hear the message more than once and not just from the government. You know, we got to talk word of mouth. This is really key because we have so many families that have had access to medically assisted treatment, access to counseling and so forth, and then they get something in the mail and they miss it. It gets delivered to their neighbor. They don't get the notification. Next thing you know, they go for counseling for their child, for themselves, and they say, "I'm sorry, you're not eligible. We can't pay it. Here's your bill." And it's added stress on families. And we're doing everything we can to reduce that stress and support mental health. Lastly, I think we got one more slide. Special populations, you know, for families that have children age 3 and under, they've never had to deal with this because we've been in this odd time of the pandemic for the last 3 years. It also has strategies for youth aging out of foster care, which we know affects a lot of folks that we're connected to through our Birth Parent National Network. Go ahead to the next slide real quick. So again, you can find more information on the CMS website. We'll make sure these links get put in the chat and sent out. There's a lot out there. Go on to the next slide real quick. I had more slides than I had time to talk about. Again, resources that we will provide out to you all, but I just really want to kind of emphasize that this is the real life. When we talk about the community level, it's one thing to have $1 billion out here, but if it's not supporting our efforts at the community level, we need to do everything we can to connect those dots, make sure families do have access. There's things through the Support Act when it was passed in 2018 that says medically assisted treatment is eligible for Medicaid, period. You can get it, but there's things that the provider has to do to make sure it's paid for, so that if you need medically assisted treatment to deal with substance use disorder, it should be available and paid for, but there's paperwork that goes with it. So we need to do everything we can to help that. So I'll stop there, make sure we answer questions and so forth, but I appreciate everyone's support for mental health.
I want to
Jody.
I want to thank you, Jim and Emily, for this amazing information. I think we don't really get this kind of information very often, and it is so important. So thank you both so very much. There are a couple comments that I really wanted to highlight from the chat. So much incredible information. Now we need to get these programs into the hands of families who needs them. Robin said that, and I thought that was, it just kind of hit the nail right on the head for where my heart was, and I really wanted to highlight that, as well as Kara said, let's dream, everyone. what all could we do together with our community and with our communities? So like, I want to challenge everybody to be thinking about that, to really be thinking, what can we do together and take to our communities and do with them, right? And then there was a couple questions that did come through. And so one came through privately, and so I want to ask, and it was, what does HHS stand for?
U.S. Department of Health and Human Services. So I was talking about the federal government, but there are state health and human services departments too. Some states call them different, have different names for them, but I was referring to Health and Human Services.
Thank you so much. Another question was, where could parents go to keep up to date on all of this work?
So Jim provided a couple of links, and I think Kara, somebody was providing some links to SAMHSA and to a couple of the other sub-agencies that have some of these programs. I'm going to send out, there's a pretty comprehensive document that was released around a lot of what I talked about, with some helpful links. So I asked Kara to give me one more day to prepare and to insert some extra links for things where folks can find some helpful information. But you'll get a resource that will have a lot of that linked in it.
Thank you.
Emily and Jim and Jody, this is Meryl. If we want to put together a document when we post the webinar recording, we could also post all of the resources that you're sharing today in one document for the members. So we'd be happy to do that. Okay.
Thank you guys. Thank you so much. And there's one more question. I'm seeing it from David. I know Jim already seen it, but maybe we could highlight it. What is the age limit for Medicaid renewals?
Yeah, so there's, to my knowledge, and Emily, correct me if I'm wrong, or there's others on the call, there's no real age limitation on Medicaid. It's typically for adults because children are often covered under, but the coverage is not. There are, when we've done some analysis, most Medicaid expenditures actually go to children and to seniors, even though it's seen in the public as largely a social service program for low-income individuals. The vast majority of expenditures through the Medicaid program support children and seniors, things like nursing home care, as well as then other health care, mental health services, and so forth. And the Medicaid expansion through the Affordable Care Act has broadened out that eligibility for thousands of individuals across the country for the states that have enacted that expansion.
Yeah, Medicaid is an income dependent eligibility. Medicare is an age restriction because it's for older Americans, but Medicaid is based on income. CHIP is the Children's Health Insurance Program, which is basically for kids who don't qualify for Medicaid but are ineligible, but can't get to the private insurance space. I think that's like the gap filler for kids who fall into that, like that gap. That's what CHIP is, and CHIP is specifically for children who are not eligible for Medicaid. But it's not, there's no age determination there.
So, and I wanted to highlight, there's a comment in the chat and it's from Grace, but before I read it, I wanted to ask if Grace wanted to come off mute and share what she shared.
Hi, good afternoon. This is Grace. I am here in Bastrop, Texas, and I am the Director of Inclusion and Resilience for a nonprofit organization called Bastrop County Cares. Thank you for having me. This is a little off topic. I know everyone's talking about Medicaid, Medicare, and I just wanted to know, has anybody thought about addressing mental health holistically? For example, using maybe dance or movement or nutrition or, you know, anything that has to deal with healing modalities of some sort. Has anybody thought about that? And if so, could you let me know? Because I would like to be a part of that.
Definitely. I think you bring a really good conversation up, Grace. So I want to encourage anybody and everybody to reach out to Grace and keep this as an open conversation. I know that I will be, Grace.
One,
now,
I know we're just real quick on that, and it was mentioned music therapy in particular. I have some friends who are active in that profession of music therapy. There is a move, and I think some locations have gotten music therapy supports approved for Medicaid funding. It largely depends on your state plan. So there's a lot of flexibility the state have for what is funded under Medicaid eligibility, what types of interventions, therapies, and so forth. And so I think some places are adopting those more holistic types of approaches. Again, a lot has to go into it as far as its clinical eligibility and so forth like that. I think we're a long way from that being a part of the Family First clearinghouse, but I think where there is local flexibility, that's probably where you're most likely to have that type of support funded.
Awesome. Could you send a link? Can you put a link in the chat?
Yep. Let me text my music therapist friend and find out.
Thank you.
thank you guys so much. And I want to again thank Jim and Emily, and also say that the Alliance will be pulling together a full fact sheet of resources, but I want to pass it to Kara because I know that she has something exciting tied to this.
I do, Jody. Thank you so much. So it's funny, Grace, that you're like, I don't really know if this ties in. It completely ties in because something else that happened at the federal level is they recently issued what is called a resilience challenge. And that was an opportunity for different communities to share different unique opportunities of how do we help support children's mental health. And it's interesting that Leanne just dropped in something about equine therapy, because any of you that know me know that I have a newfound love of horses. And my local stable here actually submitted a proposal for that resilience challenge with the feds, and we are awaiting to find out if it was selected. But they were uniquely looking for things that were like music therapy, equine therapy, unique approaches to how do we help support children's mental health. So stay tuned, be watching for that. I will make sure to find a link that will hopefully keep us up to date of how that is developing. But it was a unique opportunity that the feds rolled out for community organizations, which again led to more of this of everyone from the BPNN is asking for mental health. Everyone from the BPNN is talking about it, and we need to start helping you have all the information that Emily and Jim and others are sharing, because unless we share with each other, how can we bring this information back to our communities? We don't have enough hours in the day to gather it all. So we need great places like this to pull it all together. But also, one of the novelties of the Birth Parent National Network is the fact that we are a network. We're a network of people who really care about families and community, but most importantly, we also care about each other. And it didn't feel right to have this webinar just be all facts and policy. It was important to bring in parent voice. And so today I have invited two of our incredible members from the network to share a little bit from that parent perspective. Because as you've heard all this policy stuff happening, in partnership with policy, we need family voice, because that's what's going to help keep driving this, encouraging this, and pushing this forward. And so I'm going to first start and begin today with a new friend, a new mama ally that I have in Kristen, who I have really enjoyed getting to know as a new member of the Birth Parent National Network from the state of Illinois. And we've had quite a journey as we've been talking about mental health. And it was funny because that's how our conversation started after she was learning about the BPNN. She was talking about what she was passionate about. And I encourage all of you to do the same. But Kristen, I'm going to drop our slides because I want everybody to see you and I as we have this opportunity to just share a little bit. And I'm wondering, when you heard me talking about this great big webinar, what does wellness and community really mean to you? And what does it look like? Because I feel like you have a great approach to how you would define it.
So to me, a community that has the better good of everyone and really supports available to those with immediate need and access. We must build foundations in our communities on the values of inclusion, diversity, and belonging. A healthy community needs to be honest upfront with all of their shortcomings. We must view mental health in our communities as an obstacle and not so much as a problem by building relationships and allowing those relationships to prosper and grow. Personally, for me, building the relationships at the community level has allowed me to start to deal with my mental health and how I need to address it so that I'm able to also be there for my children and take care of them and their needs. Having a healthy community is very important because it allows us to lean on each other for the downfalls and also the highs. It's so easy for just one wrong thing to happen in our lives for us to want to shy away from the world and end up possibly isolating ourselves, not talking to our friends or family, staying hidden, because that way you're hidden from what you feel is a problem. So to me, talking about mental health and also saying like, hey, it's okay to struggle with mental health, because at the end of the day, in order for us to really have those resources and it work into our community, we have to accept those that do struggle and those that don't, and know when to seek and when to seek those that haven't seeked us yet. So staying aware of those surroundings and understanding them.
I so appreciate that, Kristen. And I see so many people are agreeing with you and being like, yes, 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 in the chat. And I'm wondering, like, in your experiences and like, as you hear us talking about today, elevating a family's voice and families talking about mental health, why do you feel it's so important that families start talking about it more? And like, this becomes kind of a buzz that's happening in community.
I would have to say, to help break down those social norms, what society deems as like what's the standards. So like reforming the standards to our mental health services and really definitely getting in that resilient piece to where we can support as much as possible during the resilient time.
I love that, because I think sometimes during those moments where we're having to stretch our resilience and build our resilience and flex that resilience muscle is those times where we need others to come in. And that gets to this next question is, how can communities respond differently to really address these needs of mental health? I feel like some of the policies that Emily and Jim were talking about that's getting some of the funding and policy in place, but what are some of those tangible things communities could actually do today, even if we could get them going on these new thoughts?
So definitely by interconnecting and showing up for each other, building those relationships, reaching out, asking parents if they are not as involved, if they're okay, if there's anything that we could assist them with. Also including different subgroups, so groups that need to find their belonging and their space and their place. We need to look deeper into the affordability and the access to make sure that our social services are getting taken care of so that they can also give that back in return.
I love that. And I love the fact of thinking about not only thinking about the families, but thinking about that interconnected piece of how do we take care of the providers? How do we make sure we're all strong so that we can show up? And one of the things that I loved as we were getting you ready for the webinar today, Kristen, is you have done so much homework of just getting your thoughts together and dreaming bigger and pulling together all different things. But you have a lot of big dreams. And I want us to give you an opportunity to just close on that. Of what is your big dream for families around this idea of wellness?
So my big dream around the idea of wellness in the community at the community level would be kind of going back to what I said before, the diversity and inclusion and acceptance, feeling like we belong, having a safe space, having somewhere where if I am struggling, I can say, hey, I'm struggling right now, and I can have a team of people be there to help support me until I can get better to support other people. Social services, it really starts with all of us in the service field to support our community members. So letting them know that it's okay, I'm here for you, is extremely important.
I totally agree. And I know there was a special quote that you found, and I'm wondering if you would like to share that quote as your final thought, and then we'll tie it into a great resource that is available for everyone.
Yes, so a really good quote is by Oprah Winfrey in her 2012 grad speech, and it was, "We must create a vessel in order to serve. First, we must serve ourselves in order to serve others."
Wow, so powerful about the importance of us taking care of ourselves, because I know so many of us that are on today will be listening to the recording and that do this work every day. It's hard to put ourselves first. And I love that you found that quote and elevated it, because one of the resources that we have, that it was kind of a neat aha moment when Kristen and I were talking, is I was like, well, Kristen, guess what? It ties to a resource we're going to be sharing, which is a book club guide that's available for the network right now. It is tied to the book that Oprah and Dr. Bruce Perry wrote called What Happened to You. And this guide has reflection questions, journal pages, coloring pages. I encourage you to check it out if you haven't already. It's just a great tool and resource. And what I would encourage you to do is approach this book from an idea of, we all have been on a journey in life. Let's figure out what we've learned on that journey, how we've grown, just as how Kristen has shared on her own journey of how she's grown, what she's learned, and how she is working so hard to make a difference for families in her community. And Kristen, I can't thank you enough for taking the time to share a little bit of your heart and passion. And I know you are truly on fire and have so many great things to share. And I can't wait for when you come back to share some more with us. And now I'd like to hear and give an opportunity to Tremel Mitchell, our co-facilitator and our incredible friend from Alabama, to really give an opportunity to allow us to hear from a father's perspective. Because sometimes I think as we approach this work, we don't always give the same space for a father's voice to be heard when it comes to social, emotional things and when it comes to wellness. And so, Tremel, I want to open the floor and ask you the same questions I did to Kristen, but I want to hear it from
Awesome.
you. You have great wisdom.
Well, listen, Kristen just brought the fire. Like, y'all put some ones in the chat if y'all loved everything you said. I want to give her my time. She was so good, man. So thank you, Kristen, for sharing and being vulnerable to let us know more about, just encourage us in that mental health piece. So thank you. So Kara, what questions you got for me?
All right. First and foremost, I know, Tremel, you really try to promote well-being and just really having people take that pause and making sure they're taking care of themselves. But I'm wondering, what does well-being and community really mean to you? And what does that look like?
Man, I just kind of want to not to say a lot of the repeat things, but Kristen really put it in perspective of everything she said. She said it so beautifully. So one, I just want to agree with everything she said. Mental health for me in the community means a lot. It's really beating the stigma, especially as and I'm sure some of you may or may not heard that the stigma around the African American culture, on mental health. And so, I tell people when I look at the word mental health in my community, as for men, if you break the word mental, men tell. We want to tell what's going on inside of us. Like, we want to be open. Doesn't matter what color I am, or, men want to talk. It's just, we don't know where to find these platforms to feel safe to talk. And so for my community, it's just finding a safe place to be able to talk about who I am in my culture, along with the cultures that I'm surrounded with, and just feeling safe in that environment. So.
Wow, Tramel. I love you always give me these acronyms that get me thinking and thinking in new ways. I love it.
I love it.
And I'm wondering, why do you think mental health is an important topic for families to start kind of normalizing, elevating, getting going in their communities with their friends and their social circles?
Well, Kara, I'm a storyteller. So, everyone, I want you just to, as I begin to tell these stories, to really bring that question apart. I want to know what you're feeling as I tell these stories. And so I'm going to tell you about a father who had two children, and why mental health was so important. He was homeless for 3 months. His first bed came off the side of the road, and he was just dealing with a lot, trying to get his kids. He was paying $900 in childcare. And he was just going through a lot. And so I just want to see in the chat, like, what do you think the moments that he's probably feeling right now, as a father? And he didn't get the support he needed. He tried to find mental health. He didn't have the funds. It was either food or his mental health. And so he was turned away from a lot of programs that was more predominantly for women, and it wasn't for men. He was told to work multiple jobs to try to find out a solution. He went through a divorce, trying to get custody of his kids, couldn't pay for an attorney. So all these things were going on, and he had no hope. And so he's homeless for 3 months. In his story, his mother took his kids for 3 months to try to help him finish school at a really number one university in America, and he's going through his degrees. And he just couldn't really figure out, and he was going through like a lot of mental issues. And so one of the things that this dad told me was, does anybody have a water bottle? Can anybody hold up a water bottle? Anybody have a water bottle by any chance? Okay. So in the chat, what do you do with a water bottle? Well, it's like, tell me what you do with a water bottle. When his dad was telling me this, put it. I want to see it in the chat. What do you do with a water bottle? You refill it, you drink it. Now, let me ask you this question. Have you ever looked at a water bottle and said, this is my bath water, before I go into an interview? Like, think about the mental health that this father is still going through. Some say you say drink it. And so, of course, working with this dad, he had a lot of resources through the Children's Trust Fund, and in partnership with Alliance has built him where he is. And so in that mental health, he just felt really defeated, like some of you put. What are some solutions that you guys think that this dad could really have to help him as a man in mental health? What do you feel like that could really support this father in this moment? I just want to look at the chat really quick. And so I'm looking at the chat at the same time. So when I look at mental health and why that's so important, and I'm so glad that you got maybe a support group, have some people to talk to. And I think that's what this dad began to give. And so why mental health is so important to me, because that man was me. That was me. My first bed came off the side of a road, and I was screaming, help me, help me. Will somebody please help me? And I will let you speed up to where I love mental health as an African-American male. A lot of the battles I felt mentally was, I'm an African-American male. Maybe I'm just a charity case. Maybe I'm just a token. Nobody wants to help me. But I was in a group, small group, you guys a support group, where some men who didn't look like me, and they loved me very well. I'm still in this group today. They're CEOs, they're business owners. I'm like, I do not belong in this group. And to this day, they ask me for more mentorship and mental health for their children, because I work with kids all the time. And so it was just a really nice cultural trade-off to understand that they didn't look at me as an African-American male. They looked at me as a brother. And let's fast forward why mental health is so important to me. My two children, I have two beautiful children, Prince, who is 10, and Princess, who is 9. Yes, they're real names, y'all. I don't know why, but it just worked for a moment. And so just recently, I'm traveling in Washington right now in a conference, and 2 days before, so my kids haven't seen their mother almost 3 years, and so that mental health for them. And so our journey was a lot of places have turned me away. They said, yes, you're in. And then I got a call back and said, you're out. And that was due to insurance or stipulations. And I just didn't understand why. And I said, my kids are hurting. When he was 5 years old, he wanted his mom to love him so bad, he tried to jump out of the car on 280. So I'm painting this picture because this is what real mental health looks like. And you looked at me, he was like, man, he looks great. He's got a suit on. But 2 days ago, my son cried for 2 hours saying, Dad, why does my mom doesn't love me? I have kids for 5 years, Dad, picking on me in school. When is it going to help? And I was so excited. I felt like I had hope. And you're guys gonna hear this a lot from me. That's all I had was hope through individuals. And the first H, if you want to write this down, the first H was healing. I got around a group of people who decided to let me heal organically. And when I began to heal, I started seeing the next O is opportunities to become where stigma didn't tell me I had to be. And so when I began to run through those opportunities, there's so many opportunities come out of when you're going through a healing process, like going in a candy store. But I had to boil it down to, what is my purpose? Why did I get this healing? What are the opportunities? And what's my purpose now? And I think that's why I've just came alongside the Alliance and so many other amazing programs, because I want to be in my purpose to help others as I tell my story. And if you put HOP together, it's hop. And so I didn't want to just hop around in life, right? And so the last E is that I really want you to really grasp this last E, because the last E really kind of comes first. And a lot of things that what mental health does for us, it takes away. So when you're depressed, most people just lay in the bed, just really struggling. And so, guys, I had no energy. Ladies, I'm gonna say this: I had no energy to do a ponytail. I didn't know how to do a ponytail. I'm just gonna tell myself. I don't know how y'all do it, but it was hard. I tried the vacuum. My daughter did not like that one. Okay, so she said, "Dad, stop it. Unplug it now." Okay, and so when I had two babies, and especially a girl, because Prince was okay. Princess, I'm like, girl, it's a struggle here. Like, she's like, Dad, stop buying my clothes. Like, you just don't got it, okay? And I accept that. But what I really want to tell you in the E was I had to have energy to keep my hope alive. When I was homeless for 3 months, I remember sleeping 4 hours a day, paying $900 in childcare, and there was no way out. And taking $18 semester school at Auburn University. And being told every day, there's nothing we can do for you. So I go to bed, I pray, maybe something come different tomorrow. And at the end of the story, that came back. And so, Carrie, to your question, in my storytelling, mental health means a lot for me because I want to give hope to individuals, because mental health requires a healing process first, the opportunities from those healing process, and finding purpose, why you have life to breathe. What's the next step for you? And I always tell my people, go grab somebody in the H phase, okay? So they can see the same opportunities and purpose. And then y'all get together, because two or more gather, y'all are so much better. You got more energy when you're not alone. And that's how you defeat darkness, is not be alone. Because if I have two little lights, I can make one bigger light.
Wow. So many thoughts. And Tramel, I hope you see all the love that's coming to you in the chat throughout. And Tramel, as we get ready to close out for today, I'm wondering if you might just briefly share what's a big dream you have for families around wellness?
Well, my biggest dream is let's look at diversity and mental wellness. That's a real thing. Let's see people for who they really are on the outside, but let's really get deep in the inside. And I have a little nephew. He gets so much love from me. His mother, father not there in his life, and he's white. He's a white kid, and I remember him calling me. He said, "Uncle Mel, my dream is to be a football player." And I said, "Buddy, you can do it." But he said, "I don't have a dad to help me. Will you be my dad?" And that was a week ago. And the dream is for the mental health is to begin to be the father figure. And my nonprofit is a Father's Voice Matters, and we have a Mother's Voice Matters as well, is to be the father voice. My dream is to make sure that I'm a sounding board to many kids who I might not look like you and your father, but you got a father in me. And really just my dream is to see more men step up in that fatherhood position. And let's start helping.
Oh no, Tramel, you froze. Okay, you're back, Tramel.
All right. So my goal is, with my Father's Voice Matters is to become a father figure for most kids. And our moms, you guys are doing an amazing job. Y'all have a superpower I just don't have. Like, I just tell you, like, I got to AI this thing sometimes. Like, how do you do this? For y'all's a mess, artificial intelligence, type something in, it just comes up. So, but my biggest dream is to bring diversity to the forefront what it is. And I'll say this last thing is to become the solution and not ask what the answer is. And one thing when you're looking at diversity is you have to go to history to understand those individuals. Like my little nephew, he doesn't like me. I got to understand. But I'm not going back to get answers. I'm going back to become what he needs in the future. And I think if we can be, we can come along everything that we're trying to do. And so and I will say this, when you become as a movement. If you are saying, I became today, then you've never became at all. You can't see this process of becoming. It is a movement that will never stop if you stop looking at yourself and look at those in front of you. So, and I'll say this, thank you, Kristen. You have inspired me to speak this way. You're amazing.
Thank you so much, both Tramel and Kristen, for just giving that parent perspective and that parent voice. And we were going to have one other BPNN member who unfortunately fell ill and was not able to be here today. But it's weighing on my heart that I feel like I need to bring what led me to ask this BPNN member to speak today. And it was a post that they recently did. And so this is my gift to you of what they wrote. To the mom running her child to ABA therapy while her friends are driving their children to soccer practice, you're not alone. To the mom carrying around a textbook, you rock. To the dad avoiding milestone conversations with his friends because his child is years behind, your child is perfect just the way he is. To the mom embarrassed by her son's screams at the grocery store, I've been there too, yesterday actually. To the mom on her computer researching what kind of therapy is best for her child, your child is lucky to have you as his advocate. To the dad afraid of taking his child to a restaurant, park, or any kind of public place, I know it's difficult. To the mom still mourning the dream of taking her children to the movies or baseball practice, it may not happen how you pictured it, but it will. To the dad feeling silly because he celebrated his son say "buh" for bubbles, every single victory is worth celebrating. Open up, give that celebration. To the mom holding in her tears after another therapy report that makes her feel like her child is not progressing, don't lose hope. To the dad wishing his daughter would talk, me too, you're not alone. You are not alone. When you feel hopeless, when you're struggling to keep going, remember that you're not alone. When you feel like nobody notices you unless your child is screaming, when you're wondering how you're going to do it any longer, I want you to remember that you're doing an amazing job. You love your child. You're doing the best you can. When you feel like nobody understands what you're going through, remember that I do. And there are a lot of us out here. It's okay to have bad days. We all do. To all the moms and dads out there who are trying their hardest to give their children the best possible life, despite the circumstances. You are amazing, and your child knows it, even if he or she can't say it. Here's to you. And that's a piece that was written by Pasquale Nigoon from Louisiana. And I felt it was important to elevate that because sometimes we need to hear it. And sometimes it's hard to hear it from friends or family because we don't always buy in. But I hope that you hear it from an amazing member of our network and know that it's true for all of us as we think about and have this opportunity to be together today. You all know that I like to dream big. So here's our brief opportunity to start doing that. Today, I hope, is the first of this conversation around mental health. I'm going to share screen and show you a QR code for Mentimeter. And I'm going to drop in the link to the interaction in the chat if you prefer to use that instead. I would encourage you with that link, you can put in as many ideas as you have. What other resources would help you as you advocate about mental health in your community or state? What would help get you lit up, excited, help you to be able to share? Because we all know there's so much information. Look at all Emily and Jim shared today and think about, you're going to be getting the recording, the slides, a one-pager with all this information. There's a lot coming for you all, so don't worry. We have your back. But what else would be helpful? And this Menti is going to be a way of us collecting some of that information and thoughts, because what I hope you saw, if nothing else, with today's topic is that we're listening to you. This network exists because of each of every one of you who are on today and who will listen to the recording. We want to support you. We want to be a network where we swap ideas, like Jim putting in all those music therapy resources across different states. Love that. We need to be able to share great practices, what things are working, both traditional and non-traditional, because as we all know, what works for one family doesn't work for all. So I hope you take some time to drop in some of those thoughts and some of those ideas. Jody, I'm wondering, do you have a quick idea that maybe is top of mind for you while I pull up these results and see what we have so far?
So for me, I think, like, especially after what I heard here today, I'm just so moved. Like, my heart is just so moved. But I'm feeling like it really starts with the community, and it starts with us, and it starts with us being aware, right? We need to educate our children who don't have these challenges to, like, reach out and welcome and guide people who really are struggling. I mean, I feel like I have, like, tons of ideas and thoughts around, like, as far as policy and practice and how, the supports that everybody needs. But the truth is, I want to say that it really does start with us in our community and having that helping hand to reach out and say, come on, I got you. Like, we can do this together. Like, hearing Chermel, like, what did Chermel need? He needed somebody to extend a hand. Come on, we can do this, listening to Kristen, like, it all came back to that community and that support. And I think at the end of the day, that's really what it comes back to. And for me, I'm thinking about, like, the name of this meeting today: Wellness Begins in the Community.
Wow, Jody, so powerful. And I love it. We're getting a bunch of different thoughts, things about building a co-parent family center, marketing support, tech support, the resource list, elevating solutions without being bullied, right, by leaders about it as we build that up. Even thinking about, again, that whole concept of, you start talking mental health, there can be some stigma that you're dealing with or going up against. Figuring out where and how to find those grants, more diverse and culturally specific therapists and creative techniques, resources that include connection and support, peer groups, and a path. I love it. Keep those ideas coming in. I really appreciate all of you taking the time to share some of those thoughts with us, because we want to be a solid resource for you. And as I shared, one of those resources that the Children's Trust Fund Alliance has available for you right now is that book club resource that you can use as you are working in your community, as you're trying to elevate and normalize these conversations about seeking and asking for support. additional resources that exist. And again, all of these links will be made available to you post this webinar, include things like a social media campaign that the Children's Trust Fund did around resiliency, with different techniques that you can use with your children, sharing it in the community for other parents. And there's all sorts of different things, ranging from dealing with media coverage, dealing with different techniques you can do. And what I'd encourage you to do is don't forget, even for your older children, some of those younger things are just as powerful still, despite their age. So I encourage you to explore and check those out, as well as really look at the protective factors framework. And we have a dedicated set of resources all around the social emotional competence of children. That's a super long, fancy way to say, how do we help our kids manage their emotions, name their emotions, and own them? But it's also about learning those strategies even for ourselves as adults. And just because we learned it when we were little doesn't mean we're masters. We're always learning, we're always growing. And I hope you took that away as a powerful reminder for today as well. I also want to remind you about Family Voices United, the collaborative between the Children's Trust Fund Alliance, Generations United, and Foster Club, where we bring together different lived experience voices, and they have some great pieces where they have solicited resources around mental health and other topics. So I encourage you to explore that website. I'll specifically draw out a couple of those resources, but wanted to give you the overall website as a tool and a resource to go to and explore. We can't thank you enough for being with us today, and we look forward to seeing you back in October for our next BPNN webinar. So please save the date, Thursday, October 26th. It'll start at 3 p.m., so an hour later than today. I know it's been wonky this year. It keeps flopping. We're trying to be accommodating to all of the different time zones that we work to accommodate with our network members. And so please share with us how things are going. We have a possible topic in the works, and actually a possible second topic even in the works. And so I encourage you to be checking that out. Please check out the BPNN website, because we have all of the ICWA webinars are up there, as well as all of the previous webinars from this year. These materials will get posted to the website shortly as well, and we'll be working on that kind of compilation of all the resources and try to make sure it's clear what each one is, so it doesn't feel too overwhelming. Of course, evaluation. Please, please, please take time to do this really short evaluation. Give us your feedback. Let us know what you're thinking, because that is how today got developed. I need to hear from you. What worked, what didn't, what was too long, what was too short, what was missing. I really appreciate when each and every one of you takes just a couple of minutes to fill that out. I know it's been a long hour and a half, and many of you might be jumping to meetings. And so please know, I will be sending this in a follow-up email, but if you want to take some time right now to fill it out, that would be so great and awesome and appreciated. And I just want to give an opportunity as we close out to give a shout out to the leadership at the Children's Trust Fund Alliance. Meryl Levine, our National Director of Parent Partnerships, is by far my most amazing support as I do this work with the Birth Parent National Network, and as I try to support and build relationships with so many of you. And so I wanted to give her a shout out, as well as our incredible executive director, Teresa Ravel, who is the person who I first met when I got connected up with the Children's Trust Fund Alliance and taught me what partnering with parents really means. And it's about relationship. It's about really looking at how do we explore things together? How do we help inform? And most importantly, how do we work not only at these little checkbox moments, but from beginning to end together? And so I hope today was informative for you. I look forward to staying connected with you. If there's questions, follow-up that we missed from today, please don't hesitate to reach out. We are happy to connect. And I just want to pass it one final time to the lovely Jody to say final closing and goodbye for today.
Yeah, I just want to say thank you, everybody. I'm so grateful that everybody came, and I think today was just such a rich topic. I feel like everybody came and brought their hearts, and that is what I love. So I just want to say thank you, guys. I love every opportunity I get to share a space with you guys, and I hope that everybody has a great day.
Thank you, everyone. Take care, and we look forward to seeing you soon.
Jim says, just keep living.
Absolutely.
This is good.